Using donor eggs or donor sperm or donor embryos is a very difficult decision. After all, everyone expects to make babies in the bedroom, and then when you find out you're infertile, that's a blow. And then when you find out that your eggs aren't good enough, that you can't get pregnant with your own eggs and you need to borrow someone else's eggs just because you're too old and that woman is younger, can be heartbreaking, because we all expect to transmit our genes to our kids. We expect to see ourselves in our own kids, and when that's not going to happen, that can be a bit of a rude shock. It's hard to come to terms with this. And lots of people who consider using donor eggs will never come to terms with the fact that that's the best option, and they will always push the issue or try desperate measures which unfortunately don't succeed, because the most effective treatment for patients with ovarian failure or poor ovarian reserve is donor egg. For the other group of women who do accept donor eggs, they fall into two groups. One is angry, unhappy, frustrated with their own body because they couldn't produce enough eggs, with God for giving them such a ordeal that they were forced to use donor eggs. They're not happy, but they kind of compromise and say, well, I need to give my husband a child, or my mother is insisting, or my mother-in-law is insisting, so let me sacrifice my desires for the greater good and just accept. But that's not a good reason to say yes to donor eggs. The whole point about having a baby is you should do it for selfish reasons. If you're happy, you'll keep your baby happy. If you're not happy, you're not doing anyone a favor by saying yes to getting pregnant. So remember that. It's got to be something which appeals to you, something which you want to do, because you want a baby more than anything else. You're not fussed about whose DNA it is. And lots of women will actually fall into that category, who will say, look, I just want to get pregnant. I want to shower my love on a baby. I want to bring a baby up. I want to teach a baby how to talk and how walk. And I don't care whose DNA that baby has. These are the women who are extremely happy with doing donor eggs. They make great parents. They actually come with an attitude of gratitude because they're grateful the technology exists. They're grateful that they're healthy young women who are willing to donate their eggs to them. So I agree it's not easy, but a lot of it really depends on how you tackle the problem, how you frame it. And don't forget, at the end of the day, you're the one carrying the baby. You're the one who's going to give birth to the baby. It's going to be your name on the birth certificate. Yes, you will have nightmares and anxieties. What will the baby look like? Will other people suspect? But at the end of the day, your baby will talk like you, laugh like you, and smile like you, because you're bringing your baby up. And honestly, I believe babies born as a result of IVF, whether it's donor egg or not, actually have a head start, because IVF parents spend so much more time, love, energy, and attention on their kids that it's far more than any other parent will do. Have questions, please feel free to talk to me. My website is www.drmalpani.com, and I'm an IVF specialist, and I'm happy to offer you a free second opinion. Look forward to seeing you on the website.